I always tell patients to understand macular degeneration, you have to first understand what the macula is. Remember that the retina is the nerve tissue that lines the back wall of our eye, and the central part of that retina is called the macula. The macula is responsible for all our fine detail and peripheral vision. What happens with macular degeneration, we slowly start to see a deterioration or degeneration of that nerve tissue, and over time, patients can slowly lose vision. Macular degeneration typically presents with early, we call dry form of macular degeneration, where we see these tiny little yellow spots in the retina. And oftentimes in early cases, we don't have any symptoms, which is why it's important to get routine examinations, especially when you get older. In the more advanced stages of disease, what happens is that nerve tissue starts to atrophy or deteriorate, and we start to find pieces of our vision missing or blurry. This would be a case where the dry macular degeneration is getting worse. Another form of macular degeneration, the quote-unquote wet form of macular degeneration, occurs when blood vessels actually start to grow through the retina and they bleed and leak very easily. These aren't like normal blood vessels in the eye. And what happens is patients experience a more rapid onset of vision problems. So those types of symptoms can be much more acute in onset, and that condition needs to be treated rather quickly.
My regular eye doctor from Merrimack sent me here because he thought I had a retina problem and he wanted to send me to the best person he knew.
The typical patient that comes with macular degeneration, if it's the dry, early type of macular degeneration, depending on the level of severity, nutritional supplements have been shown to be very effective in slowing the process down. They're not a cure for macular degeneration, but they can slow and reduce the rate of vision loss. These are high-dose antioxidants that have been studied by the National Eye Institute and been very effective in again, slowing down the process of macular degeneration. We also recommend home monitoring of vision with the Amsler grid to detect any sudden or acute changes that might occur as a result of wet macular degeneration. The Amsler grid almost looks like a little piece of graph paper that we give patients to leave the office with and monitor that a few times a month. In more advanced cases of macular degeneration, if we're talking about, for example, the wet form of macular degeneration, there are injections of medicine that we can offer patients that go directly into the eye. It sounds like an aggressive procedure, and people first time hear about an injection in the eye and I think they get a little nervous, rightfully so. We probably spend about 15 minutes to actually numb up the eye and about 3 seconds to actually give the shot. Patients find it fairly tolerable for the most part and experience minimal side effects afterwards, and within a day they're okay. There are different choices of medications that we use, but these injections are very effective in not only stabilizing vision, but also perhaps in some cases even improving vision. With regards to more advanced forms of macular degeneration, some patients unfortunately don't respond well to treatment or have very advanced forms of dry macular degeneration. Low vision therapy can be very helpful. Low vision therapy is really aimed at maximizing patients' vision in sort of using what they got. We use everything from telescopic lenses to magnifying lenses. A new device that just more recently has come out is the implantable miniature telescope, which is a teeny miniature telescope that goes inside the eye and actually magnifies images. And for the right patient, it does work very well. So again, macular degeneration is not a one-size-fits-all treatment approach there. It really varies from patient to patient based on severity and their visual needs.
Dr. Correnti really cared about what was happening to me and explained every detail of what was wrong with my eye. I've never had such personal attention from any doctor.